All right, Brian, thanks so much. Democrats promised health care reform would save money. The president himself said that it would save money, but it's already costing many Americans more. Aetna customers, for example, now getting a letter in the mail that says this, in part: the Affordable Care Act is changing health insurance. Due to these and other changes, many people will pay more for their health insurance coverage in 2014 than they do today. One customer who got that letter, Kristen Chadbourne, joins me now with her thoughts. Good morning to you, Kristen.
Good morning, Gretchen. How are you?
I'm doing great. Thanks so much. I know that you thought that it was a little bit ironic that it was called the Affordable Care Act, and yet in the same sentence it said, now, in fact, you're going to be paying more, right?
Yeah, I found it to be ironic, but I also noticed the fact that Aetna themselves couldn't even call it the Affordable Care Act in that second sentence where they stated it was also increasing health care coverage. Mm-hmm. You know, Aetna at least is being very honest and forthcoming with the people that they provide coverage to. So that I appreciate, but just in itself saying that the Affordable Care Act is going to increase the cost of health care coverage is just, it baffles me.
Mm-hmm. So break it down for us, because I know that you joined Aetna maybe 3 years ago or so, and break down how the premiums have increased and how that affects you as far as just the amount of pay that you're actually taking home and what you're paying in rent.
Yes, ma'am. When I started with Aetna 3 years ago, I was paying approximately $450 or so a month for my plan that I'm still with. I've been very pleased with Aetna, their coverage, their customer service. They provide a great benefit. And now at this point, I received a letter earlier this summer that basically stated that starting August 1st, my health care coverage premium for the plan I've been in for 3 years was going to increase to $668 a month. And that's just for myself. I mean, no family members, no children, no dependents, just myself. Mm-hmm. At this point, it's basically forcing me to choose between a plan that I've been happy with for years, but has become less affordable, or it's forcing me to go to one of the lower premium, high deductible plans that, if I were to ever get sick or injured, would really be something that would hurt me financially. Mm-hmm. Just because the deductibles are so high and copays are so high with that lower premium plan. It would really limit my access to going to the doctor just because of the financial obligation every office visit would incur.
Right, and Kristen, I know so many people out there are nodding their heads as I am, saying, oh my gosh, I know exactly what she's talking about, because we've all sort of faced these dilemmas over the last couple of years. Increase the deductible so you don't pay as much in the premium, etc. Now, is it correct that you're working 2 jobs just to try and stay afloat and pay all these premiums?
I do. I work a full-time job, regular business hours, and then I've also recently started sort of a side business. And what that business is basically allowing me to do is have the flexibility to work hours other than business hours. Uh-huh. And it also allows me to have the extra income, because in a year where my income is going to stay the same and my taxes went up, finding an extra $83 a month for health coverage is hard.
Yeah, right.
For a single working woman, it's something that's very difficult to come up with.
Yep. Single women, married women, family people. I mean, a lot of people getting hit here. Let me ask you this before I let you go.
Yeah, it's universal for every American right now.
Did you follow the health care situation over the last couple of years when it was being passed by Congress and when President Obama introduced it? I mean, were you following it? And if so, did you actually think, wow, my health care expenses might be going down or at least staying the same?
I have followed it. I don't claim to be an expert on it or anything, but I can see what it's done in the past few years with my own personal health care coverage, more regulation, higher premiums, higher copays and deductibles. I honestly didn't think it was ever going to get cheaper. When you take away, underwriting, which is basically what it does, it's forcing an industry to provide a good and service, but it's also forcing everybody to purchase that good or service. Mm-hmm. And that right there just sort of raised a red flag to me that it wasn't going to all work out the way it seemed it was going to.
Well, Kristen Chadbourne, an Aetna customer, thanks much for your explanation, and so many other people are probably relating to you this morning. Have a good week.
Great, thank you.